My name is Carolyn Scavone. I'm 37 years old. I was born and raised in South Florida. I'm married, and last year I was diagnosed with Stage IIIB rectal cancer. For the last 15 years, I have been a paralegal. I enjoy going to Pilates, spending time with my husband and my family, and being active and outdoors. The things that bring me the most joy in my life are my husband and my dog, Kona. My husband and I tried to conceive naturally for a year. We then moved into IVF treatments. We were still unsuccessful, and I started noticing I was losing all of my muscle and I was losing weight. I had the urge to go to the bathroom all the time, but nothing would happen, and it was very frustrating. The number one symptom that I had was rectal bleeding. I had blood in my stool. That's when I went to a GI doctor, which ultimately led me to my cancer diagnosis. After being diagnosed, my oncologist had a treatment plan for me, which consisted of chemotherapy, followed by radiation, and possibly surgery. He introduced me to Proton radiation, which was offered at Baptist Health Miami Cancer Institute, which is where I met Dr. Chuong.
Carolyn is one of the unfortunately increasing number of young patients diagnosed with advanced rectal cancer, and she was referred to me to discuss whether radiation therapy would play a role in her care as well. Carolyn was recommended ultimately to receive proton therapy, which is an advanced, very highly targeted type of radiation therapy. It delivers less radiation dose outside of the tumor and outside of the area that we're trying to target, and that can significantly decrease the risk of side effects during, but especially after the radiation therapy is completed.
Dr. Chuong was very familiar with my history before I even met him. He made me feel calm, and he made me feel like he was going to take good care of me. Having treatment at Miami Cancer Institute was seamless. From the moment I met Dr. Chuong, I was introduced to the proton radiation, which is a more localized radiation treatment that spares my surrounding organs. And as a young female, that was something very important to me.
She tolerated treatment very, very well. So she had very limited side effects during the treatment. And now, almost a year later, after she's had surgery following the radiation, she's had an amazing recovery and no significant long-term side effects from her treatment. So I would say that is success by all definitions that I know of.
My life, it did not turn out the way that I had pictured it. So I've been working with my therapist now while I'm in remission to try to find a way of how to live my life again. Not talking about colorectal cancer is dangerous. If you're having any symptoms, please get screened. Talking about it and being aware of the symptoms is so important, and it can save your life.